بسم الله الرحمن الرحيم. We will study today the acute sedative hypnotic poisoning. What's meant by sedative hypnotic drugs? A sedative drugs which induce calming effect and limit excitability, while hypnotic drugs induce drowsiness and sleep. According to American Association of Poison Control Center, the sedative hypnotic drugs are the classes of medication which are considered one of top 5 drugs associated with overdosage fatality. What are types of sedative hypnotic drugs? We will study barbiturate, benzodiazepines, and we will not study the chloral hydrate, but it's very important to know its name. Uses of sedative hypnotic drugs are CNS depressant. The medical uses are we use it as a sedation for hypnosis and induction of anesthesia, anticonvulsant, and muscle relaxant. Circumstances of poisoning. It may be acute or chronic. In chronic poisoning as occurred in addiction, but in acute it may be suicidal, homicidal, and accidental. In suicidal poisoning, it's very common because it's painless die. In accidental poisoning are very common in children and old age. In children because they are immature and don't know what's harm and what's not harm. While in old age because he is not remember if he take his medicine or not. So he may take his medicine again and again, introducing himself to acute poisoning. In homicidal like murder. Firstly, we will start by barbiturate. Historical aspect about barbiturate. It is the earliest known class of sedative hypnotic and extremely popular and a drug of abuse. Toxicokinetic of barbiturate. Barbiturate is a barbituric acid derivative, and please remember the term barbituric acid because we will need it again in treatment. It classified according to their duration of action to long-acting, intermediate, short-acting, and ultra-short. Mechanism of toxicity. Barbiturate runs in 3 pathways in the inhibition of CNS. Firstly, it enhances inhibitory neurotransmitter GABA. So, the stimulation of inhibition, the end result will be inhibition of CNS. The second one is suppression of excitatory glutamate. So, the inhibition of excitatory glutamate, the end result will be inhibition of CNS also. The third pathway, when barbiturate was taken in a very large dose, it can introduce himself to the receptor, leading to also inhibition of CNS. The 3 pathways by which barbiturate can inhibit CNS, it makes the inhibition of CNS is very, very, very strong. Clinical picture of acute barbiturate poisoning. Firstly, inhibition of CNS like lethargy, confusion, coma, slurred speech, ataxia. Slurred speech is an interrupted speech like the patient don't say clinical picture but said clinical picture like this, interrupted speech. Ataxia also interrupted gait. Manifestation of coma like hyperreflexia and hypothermia. Respiratory system. There is respiratory depression represented by cyanosis clinically and decreasing respiratory rate and decreasing oxygen saturation. It may end by respiratory arrest because acute barbiturate poisoning is strongly inhibiting for CNS, also for respiratory center. Cardiovascular system. Respiratory center depression leading to what's called respiratory acidosis. This respiratory acidosis leading to cardiovascular system depression in the form of both hypotension and bradycardia. Pupil. Usually, the pupil may be constricted pupil or may be dilated pupil. In acute barbiturate poisoning, the pupil is changeable. Firstly, it's constricted pupil or mid-position pupil, and in late stage, it will be dilated pupil. Constricted pupil as a manifestation of coma and dilated pupil from the total brain insult. Dermatological manifestation is in the form of dermatological bulla. And what is the mechanism of this bulla? Because of severe hypoxia from respiratory depression plus prolonged recumbency leading to the release of or leading to the formation of dermatological bulla. What is the mechanism of and what is the mechanism of rhabdomyolysis? Because of also prolonged recumbency. Leads to answer this question, the following are clinical manifestation of hypnotic overdose except respiratory depression, lethargy, confusion, increased bowel sound, or hypothermia. Of course, increased bowel sound. The emergency management of comatose patient suspected of being poisoned by sedative hypnotic drugs is urine screen, diazepam, care of respiration, gut decontamination. Of course, care of respiration. What is the investigation could be done in acute barbiturate poisoning? We must exclude head trauma by radiological CT scan and MRI for head. We must also exclude any metabolic disease by checking blood glucose, electrolyte, liver, kidney function, and infectious disease by lumbar puncture and CSF analysis. Toxicological by drug screening. Need to answer this question. Barbiturate acts through stimulation of GABA receptor, glutamate receptor, opiate receptor, or all of the above. Of course, GABA receptor. How to treat acute barbiturate poisoning? Emergency and supportive measures, decontamination, antidote, and enhancement of elimination. Firstly, emergency and supportive measure by airway support, breathing support, and circulatory support. Airway support, like positioning of the patient by triple wear airway maneuver, we can open the airway. And airway clearance by finger sweep or suction, we can remove any foreign body from mouth. And airway device, introducing airway device. And finally, if the patient is comatose, we put cuffed endotracheal tube. Supporting the breathing by assisting ventilation and giving oxygen mask. Supporting circulation, we must treat severe hypotension which caused by inhibition of cardiovascular system by intravenous fluids, or we may need to vasopressor as dopamine or norepinephrine. Treatment of coma, hypothermia, and rhabdomyolysis. Treatment of coma by maintain airway opening and assisting ventilation and the care of comatose the patient, giving a coma cocktail and the good positioning of the patient, skin nutrition, and we must cleaning the patient from his excreta. Hypothermia by rewarming the patient slowly. Rhabdomyolysis, it have many ways for treatment of rhabdomyolysis. Intravenous fluid, sodium bicarbonate, oliguria we use mannitol for it, and finally renal failure, we may need to hemodialysis. It is the emergency and supportive measures leading to go for decontamination. Decontamination, of course, for gastrointestinal tract. In MESES, you know it's prohibited. Gastric lavage is done within its limit and giving activated charcoal for the patient. Antidote, there is no antidotal therapy. And please, if there is no antidote for any poisoning, you discuss it in your exam or in your oral exam. You must say that it has no antidote. The negative data is very important like the positive one. So, acute barbiturate poisoning treatment have no antidotal therapy. Finally, enhancement of elimination by alkalinization of urine. And you remember when we said it is a barbituric acid derivative, so in enhancement of elimination we will done what is called alkalinization, not acidification. Why? Because the barbiturate is barbituric acid derivative. Repeated dose activated charcoal, and finally hemodialysis or hemoperfusion for severely intoxicated patients who are not responding to supportive care, which is called intractable hypotension. Intractable hypotension is very difficult hypotension, not treated by the traditional way for treatmental hypotension. So, finally, we may need to hemodialysis or hemoperfusion. Benzodiazepine is classified according to the rate of absorption to rapid, intermediate, slow, and ultra short. Mechanism of toxicity of benzodiazepine is only run in only pathway, which is enhancing the inhibitory neurotransmitter GABA. So the stimulation of inhibitory neurotransmitter leading to finally inhibition of central nervous system. And if you compare between the mechanism of barbiturate and the mechanism of benzodiazepine, you will understand why benzodiazepine are more safe, because barbiturate is very aggressive inhibiting for central nervous system, but benzodiazepine by only one pathway. It's a very beautiful slide. All the students like this slide when I said that clinical picture, investigation, and the treatment is like barbiturate. The antidotal therapy for acute benzodiazepine poisoning is called Anexate or flumazenil, which reverses benzodiazepine because it is a specific antagonist on GABA receptor. Dose of flumazenil 0.2 to 0.5 mg intravenously. If there is a response, continue infusion by 0.3 to 1 mg per hour in 0.9 sodium chloride, or 5% glucose. If there is no response, so it's not benzodiazepine. What is the adverse effect of flumazenil? There are 3 precautions when we giving flumazenil as a treatment for acute benzodiazepine poisoning. Firstly, in addiction, because when we introduce flumazenil as an antidote for acute benzodiazepine poisoning, we will reverse the effect of benzodiazepine. So the addicted person will introducing to the withdrawal manifestation, which is the dangerous one is the convulsion. So we must be very cautiously using flumazenil in addicted person. Number 2, in co-ingested stimulant or arrhythmic drugs. The patient who take benzodiazepine therapy also may take an antidepressant drugs, a tricyclic antidepressant drugs. So, during poisoning, the arrhythmia done by tricyclic antidepressant is masked by the depressor effect of acute benzodiazepine therapy. And when we introduce flumazenil, the depressor effect of benzodiazepine on heart will be removed, and the arrhythmia of acute tricyclic antidepressant will be raised, and the person may die from cardiac arrhythmia. Again, the patient who take benzodiazepine as his treatment, also may take tricyclic antidepressant drugs. During the poisoning will occur for both benzodiazepine and tricyclic antidepressant. Tricyclic antidepressant cause cardiac arrhythmia, but this cardiac arrhythmia is masked by the depressive effect of acute benzodiazepine on heart, because benzodiazepine leading to hypotension and bradycardia. When we introduce flumazenil as a treatment for acute benzodiazepine poisoning, this depressive effect of benzodiazepine will be removed from heart and the cardiac arrhythmia will be appear, leading to death of patient. Finally, resedation, which may occur from 20 to 120 minutes. Enhancement of elimination. No role for enhancement of elimination in treatment of acute benzodiazepine poisoning. Benzodiazepines are preferred to barbiturate because benzodiazepine cause profound coma, barbiturate cause respiratory depression, benzodiazepine cause significant hypotension. Death from isolated benzodiazepine overdose is common. Of course, the correct answer are barbiturates cause respiratory depression, severe respiratory depression. Which is true of flumazenil? It reverses the effects of alcohol on central nervous system. It increases the metabolism of benzodiazepines. It enhances the elimination of benzodiazepines. It competitively inhibits the activity of benzodiazepine at their recognition site on cerebral GABA receptor complex. Try to solve. It competitively inhibits the activity of benzodiazepine at their recognition sites. Alkaline diuresis has a role in treatment of overdose of long-acting barbiturate, short-acting barbiturate, benzodiazepines. Long-acting barbiturate. Benzodiazepines and barbiturates share the following. Both act through GABA transmitter. Both are treated by alkalinization of urine. Both are sedative hypnotics. Both are treated with flumazenil. A and C, B and D. A and C. A acting through GABA transmitter, of course they enhancing it, and both are sedative hypnotic drugs. Give reason. Hypotension in barbiturate overdose. Uses of sedative hypnotic in suicide. Use of alkaline diuresis in treatment of phenobarbital toxicity. Flumazenil is given cautiously in chronic benzodiazepine toxicity. You must remember that benzodiazepine are safer than barbiturate, and flumazenil should be given cautiously in benzodiazepine poisoning. Coma, unresponsive to naloxone, flumazenil considered barbiturate. Coma, not responding to naloxone nor flumazenil is considered a coma of barbiturate. and thank you very much.